This is the recording for Occupational English Test, and the test is held at MedCity International Academy, Kochi on 28 August 2024. The candidate name is Jishnu KS and the candidate number is 2934. The interlocutor is Shilpa Jacob and the interlocutor number is 9347. This is role play number 1 for profession of nursing. Good morning, Jishnu.
Good morning, ma'am.
May I see your identification, please?
Yes, ma'am. Here you go.
Thank you. Thank you.
Thank you, ma'am.
This is a test of your English language and not an assessment of your professional knowledge. Keeping that in mind, speak naturally. We will move on to the warm-up session. This is not in any way assessed. So, okay, Jishnu, tell me, why did you choose OET?
Well, first of all, thank you for the opportunity. As we know, OET is an English-speaking proficiency test. My dream is to work in an English-speaking country. In order to attain my goal, I chose OET.
Good. And could you please tell me some strength that you hold as a nurse?
Being a nurse, I think my most big strength is very good communication in order to handle the patient as well as making a good relationship with the peers. So I thought it is my very big strength.
Good. So this is the end of warm-up session. We shall now move on to the role play. I'll be taking part of patient and you take the professional role. Role play will last the total of 5 minutes. You will be given 3 minutes to prepare. The role play intends to get evidence of your ability to perform effective communication with patient. Is it clear to you?
Well, yes, ma'am.
Do you have any doubts?
Not at the moment.
So you have 3 minutes to prepare and you can make notes on the role play card if you wish to do so.
Okay, ma'am.
You must return the card at the end of the session.
Sure, ma'am.
Here's the pencil and here's your role play card.
Thank you, ma'am.
And your preparation times starts now.
Excuse me, ma'am. During the role play, how may I address you?
You can call me Ria.
Thank you, ma'am.
So that's the end of your preparation time. The role play will last up to 5 minutes. Don't worry if I stop you in between.
Okay.
You can start your role play now.
Good morning.
Good morning.
Please be seated.
Thank you.
My name is Jishnu. I am one of the registered nurses working in this outpatient clinic. If I am not wrong, am I talking to Miss Ria?
Yes.
So, Miss Ria, for my confirmation purpose, could you please state the reason behind your visit?
I'm here to attend an appointment for the pre-operative assessment of my surgery.
Okay, Miss Ria, as you know, you are going to have a cataract surgery in a week. So, how are you feeling about it?
To genuinely answer to your question, I really feel anxious about it.
Oh, I'm so sorry to hear that, Miss Ria. It's quite natural. As you know, people who are going for a surgery are commonly worried about a lot of reasons. That may be because of the pain after the surgery, or they are worried about the anesthesia, or maybe because of the outcome of the surgery as well as regarding the recovery. So, could you please tell me what exactly bothering you so that we can work on it?
Yes, actually, I feel nervous about what if something goes wrong and I become blind?
Okay, Miss Ria, I understand that this is something that really weighing on your mind. Being in your shoes, I totally understand how worried you are right now. But don't worry, I assure you that you are in the right hand and we will take care of everything. Is that okay for you, Miss Ria?
Yes.
So I would like to guide you regarding the hospital policy and the procedure so that you will be more confident about it. Shall we move on?
Yeah, sure.
Okay. Basically, the cataract surgery is a safe procedure and it is a commonly performed procedure in a hospital. And a very important thing is we have a very experienced surgical team in our hospital and their success rate is very high so that you don't have to worry about it. Okay. So after this preoperative assessment, doctor will come and have a check on you. During that time, you can bring up any concern you may have with the doctor so that he will clarify everything for you. How does it sound?
It sounds really relieving.
Okay, Miss Ria. I would like, so shall we move on to the preoperative assessment?
Yeah, sure.
So this preoperative assessment has two parts. First, I would like to ask you some questions regarding your health status. After that, I will check on your physical status, which means I'm going to check your temperature, pulse, respiration, and blood pressure. Is that okay for you?
Yeah.
So shall we move on with your history collection?
Yeah, sure.
Okay. So could you please tell me whether you have encountered with any recent illness or infections?
No, I haven't encountered anything.
Okay, Ms. Ria. So, have you made any change in your regular medications or the eye drops that we have given to you?
I haven't changed regular medication, including my eye drops.
Okay, that's great. And Ms. Priya, do you have any allergic reactions towards food or any kind of medications?
None in my knowledge.
Oh, that's great. So you are saying that you are using the eye drops before. So are you administering by yourself or you need any kind of assistance?
No, I'll be able to manage it by myself.
That sounds great, Ms. Ria. As you know, after the surgery, we will be providing you some eye drops that you have to administer for a while.
Okay.
So, are you confident enough to handle this after the surgery?
Of course, I will.
So, that sounds great, Ms. Ria. And one more last question. Have you arranged any transport facility after the surgery to go home?
Yeah, of course. My daughter is going to take me home in her car after the operation.
Okay, that's really appreciable. So thank you for giving the valuable information, Ms. Ria. Now let's move on to your physical assessment. Now I am going to check on your body temperature and your pulse rate, blood pressure and your respiration rate. Is that okay for you?
Yes.
Okay. Before moving further, well, do you have any queries regarding the surgery or is there anything else you want me to address with?
No, I think I'm clear with all the doubts I had before.
Okay, Ms. Ria, there is nothing to be overly alarmed. The surgery is quite simple procedure and the pain after the surgery, everything will be less and the complication is very less. You don't have to worry about it. You are in safe hands. Okay. So, Ms. Ria, please wait for a while. I'll be back with the necessary equipments to check on you. Okay. If you have any concerns, don't hesitate to call me. I'll be here itself. Okay.
Yes.
Yes. Thank you, Ms. Ria.
Thank you. So just know that's the end of your session. Thank you.
Thank you.
MedCity International Academy. Trusted hands forever.